if I take the message of biopsy from the investigations and Staph aureus from the infections, from tuberculosis, the message is it's a two vertebral disease. Tuberculosis of bone and joint is coming as a secondary disease from the lungs or the lymph nodes. Remember, it is paucibacillary, difficult to isolate. Also remember, hematogenous, right? So the organism will come through the blood, but difficult to pick up on the cultures. When I look at order of involvement, S, H, K, spine, hip, then knee. Because it comes from lungs, so spine, then hip, then knee. SRK, Shah Rukh Khan, SHK, spine, hip, knee. That's how you remember. Tuberculosis of shoulder is dry, called as Keri Sicca. Tuberculosis of the fingers, right, is called as spina ventosa. And this is the only one that can cause the periosteal reaction. Tuberculosis does not cause periosteal reaction, right? It usually involves the joint. The only one which can cause is the fingers, called as spina ventosa. Remember, tuberculosis involves the anterior part of the vertebrae, right? As the infection comes to the blood, the lower half of upper vertebra, upper half of the lower vertebra, they arise from the same mesodermal somatic. So they have the same segmental artery. That is why tuberculosis will always involve two contiguous vertebrae. It's a disease which is anterior to the spinal cord. So it's called as an anterior disease. That is why pushy elements involvement, right, and a single vertebral disease involvement is very rare in TB. It's common in malignancies. If I look at a vertebra, every vertebra has two eyes, the pedicles, and one nose, the spinous process. And the malignancies, they will destroy the pedicle. This is called as a winking owl sign when it destroys one, or when it destroys both the pedicles, it's called as a blind bat sign. These are signs of METs. What does TB shows? TB will show paradiscal disease, reduced disc space. So remember, X-rays, we did it in the first part when we were doing about the investigation. X-rays in TB will show laws of curvature earlier, but then it will show reduced disc space. MRI can pick it up earlier. Remember, in tuberculosis, as the disease goes from anterior to posterior, so the first to get affected is the motor part, then the sensory, and the bowel bladder involvement is very rare. But if it gets involved, then it's an indication to become aggressive. TB spine, first symptom is pain, first sign is tenderness, first neurological sign is increased reflexes or clonus. TB spine management is followed on a middle path regimen, which says, if required, you will operate. You will not have an approach to never operate. You will not have an approach to always operate. When will you operate is the point here. You will operate in three scenarios: bowel, bladder involvement, increasing deficit, or no improvement. All right. The two surgeries which can be done are to remove the anterolateral part of the vertebra or the anterior part of vertebra along with the bone grafting. Never ever touch the pushy elements in tuberculosis, right? Because anteriorly the disease has destroyed, and if you go from the pushy approach, it's going to be harmful. That is why it is always better, right, to go from the anterolateral anterior aspect of the vertebra. So remember, spine TB, anti-tubercular therapy where rifampicin is #1 drug, plus surgery when indicated is called as the middle path regimen given by Professor Dr. S.N. Tulisa. Remember, in tuberculosis spine, there is loss of curvature, whereas tuberculosis of other joints, there is increased vascularity called as periarticular osteopenia. Coming to tuberculosis of the hip joint. The tuberculosis of the hip joint most commonly starts from the acetabulum, but yes, on the upper end of femur, Babcock's triangle is the commonest area for the femur, but overall the acetabulum. The tuberculosis of stage 1 will cause proliferation of the synovium called as synovitis. Position is Faber with lengthening. This is most commonly asked MCQ. As the disease will progress, this synovium and the organism will destroy the cartilage called as arthritis, converting it into early arthritis with farther and less than 1 centimeter shortening. Less than 1 centimeter shortening is not easy to appreciate. So when they mention that patient has got farther with shortening, you assume it to be stage 3 called as late arthritis, because that's more than 1 centimeter shortening. Stage 4, the femoral head gets destroyed, the acetabulum gets destroyed, the destroyed femoral head migrates from one part of acetabulum to other called as a wandering acetabulum. And finally, there is a fusion of the joint called as a fibrous ankylosis. When the disease fuses the joint, it's called as ankylosis. When the surgeon does that, that's called as arthrodesis. We'll come back to it. Tuberculosis of the spine will cause bone-to-bone fusion called as bony ankylosis, where tuberculosis of all the joints will cause Incomplete fusion called as fibrous ankylosis. Remember, fibrous is painful. Bony is solid and painless. All right. And remember, in tuberculosis, right, of the hip, first is Faber, then Fadis and wandering astrum. That's the order. Also remember, if there is tuberculosis of the knee joint, initially it will cause synovitis and knee flexion. There will be osteopenia, there will be pain, there will be limp. But as it keeps on destroying tuberculosis or rheumatoid arthritis, they will cause a deformity called the triple deformity. There is posterior subluxation of tibia, external rotation of leg, and flexion of the knee, remembered by the mnemonic PERF. Posterior subluxation, external rotation, and flexion, PERF. So this is what you should remember, my friends. And one more thing is about the arthrodesis ankylosis. We'll just come back to it, right? Remember, the term for arthrodesis means surgical fusion, not a preferred surgery. What is a preferred surgery? Joint replacement. For example, if you want to replace the hip, right, complete hip means the femur side and acetabulum, it's called as a total hip replacement. Or if you just want to replace the femoral side, it's called as a hemiarthroplasty. There are two types of hemiarthroplasty. The one which has got two holes called as Austin Moore. इसकी spelling में दो O आते हैं. The second is Thompson's, which does not have a hole. Remember, Thompson also has two O's, but the two O's don't come together. I marked this wrong in one of my exams. All right. When you have replacements, they can be cemented, which are done for weaker bones and are cheaper, or it can be uncemented, where the bone integrates with the implant and is a longer half-life, but it has to have a normal bone. So younger individuals, which one will you do? Uncemented replacements. All right. Remember, arthrodesis is not a preferred thing. Replacement is a preferred thing if the joint has got destroyed. But sometimes, if you have no other choice, you open the joint, remove the cartilage, get the bone in contact with the bone, and fuse it. And this fusion can be done in the hip by using some plates, like cobra plate is the shape of the cobra, right? The plate has a shape of a cobra, so it's called as a cobra plate. And here, what happens is there's a fusion. What causes the fusion? The surgeon. So arthrodesis. Advantage, painless. Disadvantage, no movement. If the same thing is done by a disease, it's called as ankylosis. It's a pathological fusion. Fibrous ankylosis, right? Fibrous has F. It is painful. It also has R. It is seen in rheumatoid arthritis. Whereas bony ankylosis is solid, is painless. S for solid, S for septic arthritis, S for solid, S for spine tuberculosis, or S that ankylosing spondylitis. So if I look at tuberculosis, peripheral joints, fibrous ankylosis, that is hip and knee, spine, bony ankylosis, joints, rheumatoid arthritis as fibrous, and ankylosing spondylitis as bony. This is an extremely important flow chart.